Welcome back to the Wisdom Mouth series, and with us is Dr. Gene Gilchrist. Gene, your second question though. What steps would you suggest for someone trying to help an individual or anyone looking for help for themselves?
Stephen, in the last question, we talked about stigma. And I think that the first thing one needs to do is to get over this issue about addiction being a personal failure or a matter of moral rectitude. Addiction is a disease. The American Medical Association defined addiction as a disease in the 1950s. The rest of us just aren't catching up. And by all means, help your loved ones. Yeah. How often do you think it happens that people talk about Uncle John behind his back and say, well, you know, if Uncle John had a little more backbone, he could have said no to prostate cancer. Well, of course, that never happens, hopefully, but it happens every day with addiction. So get by the stigma. This is a disease, treatment works, you could find treatment. Now, once you do that, I think there are lots of options. Of course, Stay Clean is there, stayclean.com. We have a telemedicine platform. You could talk to a counselor tonight. Our goal is that anyone who wants treatment gets it, and they get it quickly. I would not hesitate to go to AA or Narcotics Anonymous, or and Stephen, we're old enough to remember the Yellow Pages. But you would have no reason to have noted that AA was the first entry in the Yellow Pages.
Oh, okay, that's interesting.
Of course. Well, they're easy to find, and they'll give you some direction. I would not hesitate to go to EAP. I think the Employee Assistance Program at work is confidential. They're there for you or for a loved one. And I think that they'll get you to those resources. And I think that primary care physicians and clergy are very, very helpful resources. But I'll say one thing about primary care physicians and clergy. They're compassionate people. They care about your well-being. They're deeply trained in their field, but not necessarily in addictions. So find your way to an addiction specialist early. And then you mentioned either for a loved one or for yourself. Codependency is a diagnosable condition. If you live long enough with an addict, if you care about that addict, eventually you could well develop your own diagnosable condition called codependency. And too often we speak to those folks in terms of how they can help the addict. Well, we're here for them too. And don't hesitate to reach out to us for codependency treatment.
Wow, that's interesting. So, you know, if you're talking about the codependence, there's a whole bunch of those. But, you know, I like what you said. There's so many resources out there now currently. Of course, they can go to Stay Clean because you're easily accessible online, I believe. But, you know, for everybody who's listening up, you know, your MD, your clergy, whomever else you want to, please don't treat it as a stigma. And don't think it's personal failure, because it's a disease and it needs help. Gene, thank you very much for being here on our second question.
You're welcome, Stephen.